Hi there, my name is Emily Rich, and I'm an occupational therapist in Tucson, Arizona. Today, I'll be talking about pacing, exercise, and managing daily activities. Thank you to the Ehlers-Danlos Society for inviting me to speak. I'm really happy to be here today. So let's go ahead and just dive in. Big picture, when we look at energy, we're not just looking at physical energy, but in the same bucket also includes our cognitive or thinking demands, our sensory demands in daily life, and emotional exertion. This includes big emotions in both directions. Even exciting or very happy things can be really draining on our overall energy levels. And all of these together result in our total energy demand in daily life. So on the right side of each of my slides, I want to point out that there's a TLDR, which stands for too long, didn't read. And this is a summary of each slide that's intended to help you conserve your own energy. And especially if you want to reference these slides later, I hope that the information will be condensed for you. So this is a word-based depiction of the various ways that fatigue impacts daily life. And specifically, this is from the perspective of individuals with POTS, or postural orthostatic tachycardia syndrome, which is a common co-occurring condition in Ehlers-Danlos. So it affects your ability to make decisions, to be productive, to communicate. It often feels very frustrating, depletes your performance and your ability to focus. And so just helping others to really understand the impact of fatigue, not just being tired. So let's walk through an example of what these types of energy demands might look like in a day. So suppose that this young mother is preparing a meal plan for the week, and she requires cognitive energy or thinking skills to create or identify appropriate recipes for her family, physical energy to move around her kitchen and locate the existing items, and then what she needs to purchase from the grocery store. And that demands her visual scanning skills. She gets her list together and she drives to the store, which requires energy from really all areas, including visual processing and scanning, planning, problem solving, sitting upright, and frequent head turning, which might lead to some dizziness. It could cause some emotional stress, which may result in muscle tension. And the bright sun could contribute to a headache if she's sensitive to bright lights. So this carries over, and when she gets to the grocery store, she's under fluorescent lights, and there's a lot of sensory stimulation in the store, trying to filter out conversations, hearing that overhead intercom, physically walking and standing in the store, reaching, bending, navigating the crowd. And then let's say that she gets a phone call that her son fell off the playground. So she rushes to the school, and very emotionally, there's a lot of distress in that drive, followed by sensory overwhelm when she is met with her crying, injured son. Okay, so you get the picture. This is just a brief example of what a morning might be like and what occupational therapists do in terms of trying to analyze an activity to understand all of the component parts that it demands. So when you're exhausted at the end of a grocery trip, you didn't just go to the grocery store. Or for myself, I'm trying to practice this in terms of I am a new mom with an infant, and when I comfort him all day long, I don't just stay at home with the baby, and that's why I'm exhausted, but I recognize the physical, the cognitive, emotional, and the sensory demands that come with the role of being a mother. All right, so now we have this better appreciation of all the factors that contribute to fatigue. And Dr. Hakim and Dr. Posinki gave us a great overview of fatigue in EDS. So how can this information be applied to our daily lives? Well, many of us have heard of pacing. This is a word we use in daily life, and everyone paces themselves throughout the day. But when you have a condition that causes fatigue, like Ehlers-Danlos, we see that pacing is necessary on a whole other level. So in this context, pacing is a way of approaching a specific activity or a task. It might also be the way you approach your morning or the day or the week as a whole, and it really becomes a way of approaching life. Pacing for many is also frustrating, exhausting, and can feel impossible. It requires energy to save energy, but pacing is something that should be learned and practiced in a community with support. It is one tool, but it is not the only tool, and it should only be one of many in your toolbox. And definitely, we should not be left to do it on our own. But unfortunately, that is the experience of many people with chronic conditions. So what does this look like in real life? Well, let's take the example of making a batch of homemade cookies. The first step is to split up our steps into chunks. Pardon the pun, we're going to break it up into chips, like chocolate chips. The first is identifying and gathering the ingredients. Next is mixing and measuring the ingredients. And finally, portioning them out into cookies and baking them in the oven. Rather than going into the kitchen at 4 p.m. and doing each of these steps back to back before dinner and then cooking your dinner, in an ideal world, we would pace in a way that these steps are completed over a period of a whole day or maybe even 2 days. So by pacing ourselves, we are only measuring and mixing the ingredients before placing them into the refrigerator. And then later, we're going to bake them after we've been able to take a break and rest. So in doing so, we use less energy overall by spreading the task out into parts over time. Let's look at this in another way using a weekly schedule. In this example, we are showing how not to pace. This is why this one is red. This individual is resting and spending a lot of time on the couch in one day on Monday, followed by 3 medical appointments on Tuesday and significant physical exertion on Wednesday. Thursday requires a lot of cognitive energy, and by Friday, this person is completely exhausted, so they're forced to stay home and rest on the couch or on bed. Does this look familiar to any of you? I hear all the time that people feel like they should schedule all their appointments in one day to get them all over with, or to save energy because they're already driving and they can just knock them out one at a time, one by one in a day. But this is actually counterproductive. So let's transition into a more ideal week using pacing strategies. In this first example, we're going to look at just the cognitive demands of the week and how they are spread out. So Monday, grocery shopping, which requires cognitive and of course some physical demands too, as well as sensory demands. But then we don't work on finances the same day, or we don't study on that day, and we spread these out throughout the week. Next up, we'll look at primarily physical tasks. Again, keep in mind, I recognize that many of these tasks require multiple types of energy. But here, if we look at meal preparation, for example, that's going to take a decent amount of physical exertion. So in this case, we split up our medical appointments to only have one on any given day. And perhaps the dentist appointment doesn't take as much physical exertion, so we allow for exercise that day on Friday. Really ideal would be we divide up exercise into very short bursts throughout the week and spread that up as well. And then we'll look at what might be considered more emotional tasks, such as going to dinner and having conversation that might be emotional, or watching a romance film. Going to the dentist might spark some anxiety. And I haven't separated out sensory here, but you can use your judgment as to what that might look like. Using all of those 5 emotions, the main 5, and then 3 additional. So encourage you to consider how you might just try this even for 1 week. And recognizing that it takes more energy to do this, but it's a process. It's starting to look at the way that you spend your time and organizing your day and your week. And over time, this becomes easier, more intuitive, or second nature. You might even use a color coding system on your trial week, like I've done here, to identify what is primarily physical, cognitive, emotional, and maybe even a sensory as a primary. Okay, so breaking things up by the type of energy and taking rest breaks, spreading things out, etc. These are one way of looking at pacing. But it also means resting between and during activities, not pushing through, and perhaps alternating between activities that demand your upper body and your lower body muscles. It might include scheduling recovery time, but trying to limit or avoid spending an entire day in bed or on the couch, as this often results in more symptoms. So often when we get to that point of a crash, it's too late. And so thinking through what can I do ahead of that to avoid this idea of crashing and having to spend the day on the couch. Prioritizing becomes a second language, and delegating to others is often necessary. We need to do this in community, and I know that is a privilege for a lot of people, and a lot of folks don't have that. Alongside pacing is something we call energy conservation, or this idea of working smarter, not working harder, like our little turtle here on this scooter. We are going to look at some examples of ways to simplify tasks and perform them in different ways to help bring ease. So these are a variety of assistive devices that might help someone perform a task with less symptoms, or it might require less energy, or both, ideally. The first several here you'll notice have longer handles on them. So when looking for these, you might do a search for a long-handled razor, for example, or a long-handled brush. Long-handled cleaning equipment, as you can see here, or strategies for getting clothes and shoes on and off mean less time bending over, less time reaching up, if that's a challenge for you or if it provokes symptoms. Some devices and technology can decrease the need for making trips around the house. It can allow you to use alarms as reminders. So, for example, smart devices like an Alexa. Or it can also allow you to set timers for cognitive, reminders that there's laundry in the dryer or in the wash, and then automate various tasks to limit those cognitive and physical demands. For example, setting a timer so the lights turn on at a certain time of day. This can also help decrease the need for making trips around the house, and it can allow you to use alarms as I mentioned, and decrease the lighting in your house. You can even unlock the front door with some of these. So again, these are very, very helpful if you have the ability to get some of these put in. Other tools might include a blow dryer holder, a versatile chopping and peeling tool, for example. And meal preparation is often challenging. So considering how could you purchase pre-cut vegetables or use a food processor to chop vegetables rather than doing it by hand. Using a slow cooker or using one-pot meals, as well as tools like this grip aid for opening jars. These can all help decrease the demands that you have to use your hands and overall your whole body for preparing meals. Also soaking dishes rather than scrubbing them when you're cleaning them at the end of the day, and air drying your pots and pans rather than towel drying them is another way to save energy. Using a large handle on items decreases the demand on your upper body, as you can see here with this foam tubing on the far left. You can purchase this in different sizes and cut it to the length that you want and put it on all kinds of things like feeding utensils, razors, toothbrushes, etc. Additional smart devices might include a robotic vacuum cleaner, an automated shower spray cleaner, and energy conservation might also mean that you hire a cleaning service or you have a friend that's able to come out and help once a month. More low-tech ways to modify include these telescoping stools, which are great for being able to sit down on the go, or using a bar stool or a rolling chair in the kitchen to modify your position, as preparing foods sitting down at the counter or at your dining room table can significantly decrease the energy required for preparing meals. A shower chair is another example of that, or a tub bench if you have a shower tub combination. And then these sensory modification with these earbuds can decrease the volume or intensity of sound. And so then you might be able to go to a movie theater or concert or the grocery store and just notice like significantly less sensory stimulation. Many people also like to use analogies for pacing to explain it to others and even for planning themselves. The checking account analogy might be the most easily understood, where you take money out of your checking account, and as you spend energy throughout the day, you take that money out. But if you overdo it or exceed your amount of money in your account, there are overdraft fees, which might present like a crash, and a person with chronic condition might have a significant setback. Other analogies include the battery analogy or spoon theory, which is a well-known metaphor in the chronic illness community. Again, these can help create a common language that can ease the challenge of explaining energy to loved ones and to peers. So when it comes to rest, what does that look like really? It's an important and seemingly obvious question, but something we should consider. So here you'll see people watching TV and perhaps also using other technology, such as a phone for a voice call or a text simultaneously. And there's some research that shows we often use multiple screens in front of us at once. And so our brain is having to switch between multiple things. There's sensory demands, cognitive demands. It's exhausting. And so from my standpoint, working with individuals with EDS, I regularly see how this is a form of rest, but we don't always recognize the demands on our energy. You can imagine that cognitive demands, switching back and forth, even just watching a movie or spending time on the phone for a conversation, those can be draining, maybe even more than we really realize. So without a doubt, there's a lot of sensory demand, and we're really just resting the physical piece when we are watching TV or on the phone. This might look more restful to us, and many people, this is their ideal rest. But consider that these folks are out in nature, which definitely presents some sensory elements, perhaps some physical elements as well. And maybe if you have mast cell activation, there's some triggering kinds of things in these environments. It really depends on the person. Reading is going to require some cognitive energy, even though it might feel restful at times. And other times it might not be the best form of rest for you in that moment, for true rest. And then, of course, a hammock is not the most supportive position to be in. So in his case, that might not be very physically restful either. And then these folks and dog are showcasing perhaps more traditional rest. Again, I show these examples as a way to provoke conversation and to get you to kind of start thinking about what rest looks like for you, not to suggest that one form of rest is ideal for everyone, but just to show that variety. All right, for the remainder of this talk, I'm going to use some evidence from our research literature, specifically around fatigue in Ehlers-Danlos. There's 2 studies I'm going to reference here, and between the 2 of them, there are 8 factors that seem to most contribute to energy levels in EDS. The first 2 here, sleep and pain severity, will be addressed later during this summit. So I'm not going to go into these today, except to say they are definitely relevant based on this research and in my clinical experience. So next up is self-efficacy concerning fatigue. So what does self-efficacy mean? Well, broadly, it's an individual's belief in their capacity to execute the behaviors necessary to produce some sort of performance attainment. Okay, what does that really mean? Well, specifically in fatigue, this is the idea that it's our own ability to our own ability to control our fatigue. So importantly, we recognize that self-efficacy is our own perception, right? So it's our belief about our level of fatigue. It's not objective fact, it's not comparing it to someone else's level of fatigue, but our sense of control over our fatigue symptoms. So great, if we just believe that we can do it, then we can, right? It's that simple? Not exactly. So if it's not that simple, how do we use this information that this contributes to fatigue? I want to be clear that as a factor, this does not mean that we should encourage false hope of having tons of energy suddenly, or that someone is just going to magically think their way into having energy. That's not what we're saying, but it's the concept that chronic illness can feel overwhelming and often out of our control. That in itself can contribute to demands on our energy, the unexpected nature of symptoms. So in that light, counseling or therapy for chronic illness and processing all that managing the demands of these conditions means, it's often very helpful and can be very productive. There's also a study done using positive psychology interventions in EDS, and they found that in the group where people were able to choose the lifestyle interventions that they wanted, they found decreased levels of fatigue among many other things. So I want to make sure this is clear. This is not toxic positivity or dismissing someone's daily challenges, but instead it's targeting mindful awareness, focusing on a future orientation. Perhaps there are better days ahead, recognizing that everyone has bad days, but trying not to get stuck there, and using gratitude or looking for daily positives. In my own practice, I've seen how this can really contribute to the autonomic nervous system, but that's an entire other lecture in itself. So just know that I believe that this is physiological. This isn't just telling someone they need to be more positive or that it's in their head. So look at this with some potential benefit for you. I always like to say, focus on what you can do rather than what you can't do. As I said, everyone has bad days. It's just trying not to get too stuck there. The next factor is a person's satisfaction with their management and treatment of their condition. Well, this is something that can definitely feel less within our control. And a lot of times it definitely it's out of our control. Who we have in our communities, lack of specialists. So I'm not going to spend too much time on this. But I want to say that even if you don't have experts in your area, if you can just find that one person who's willing to learn, or the team that's in it to help you, even if they don't have all the answers themselves, this can be a huge help. And if you're a provider attending this, recognizing that you can be that person for someone. I think there's often a demand on patients to advocate for themselves when it's completely exhausting. But if you can find ways to identify advocates in your healthcare team who can come alongside you and encourage you and teach you about using assertive communication skills. And of course, support groups can be a place of encouragement and helping to identify knowledgeable providers. So participation in relationships and community, I just love that the authors found that this is helpful because I see this all the time in my own patients and actually in myself, if I'm being honest. If we really zoom out and take a bird's eye view, I think most of us can appreciate how having community and being engaged and involved contributes to our mood and many other areas of health. Often the challenge is that mobility limitation comes with the physical components of the condition. And that's potentially worsened really when a person doesn't have a reason to go out or if there's no motivating factors. Maybe we've lost track of friends, we don't have hobbies that we feel like we can do anymore. So I'm a fan of using mobility devices when it means that someone can go out and do more and go out and participate. I also think due to the fluctuating nature of many EDS symptoms, trying to hold these things lightly in terms of I have to use the wheelchair all the time, or maybe one day you're able to use a rollator, maybe someday you use walking sticks, but recognizing that this concept of a dynamic disability, it takes practice and it takes courage. I think we need to recognize that it really takes courage to be able to show up differently each day and to leave the house and engage with people. There's a few other elements on this slide that are worth considering, such as how to increase sensory demands. Working with an occupational therapist is a great way to do that. Ultimately, though, when a person can get to the place where they're able to do more, I find that it regularly snowballs in a positive direction, and people often find that their health improves in many different realms. Orthostatic dizziness is next up, and I could do an entire presentation, and I have for the EDS Society in the past, so I won't spend too much time here, but use those lifestyle recommendations. Dr. Rowe and Dr. Cousteau will talk a little more about autonomic implications later in the summit. So here are sort of those really obvious fluid salt compression. And then some lesser known lifestyle factors are listed here, such as elevating the head of the bed so the full body is at an incline. Using counter pressure maneuvers, as you see in these photos, can help to increase your ability to stand still, that standing endurance. Using things like calf raises, crossing your legs and squeezing your thighs, doing glute squeezes. These help with that that skeletal pump to pump the blood back up to your heart. And then I like this visual from a paper on fatigue in POTS specifically. I think it's worth coming back to, so I wanted to offer this for you. And just go through each of these categories and consider what you might be able to improve upon in terms of the way you're managing your orthostatic intolerance, if this is a factor for you. In terms of mast cell, we know this is often related to the orthostatic piece. And so we're going to talk, Dr. Maitland is going to talk a lot more about mast cell later, but I just wanted to point out, minimizing those aggravating factors. And I want to point out too that I know that exercise can be productive, and if you overexert, that can be actually triggering for mast cell symptoms, and the same with fatigue. So we often get in this cycle when it comes to exercise and fatigue with mast cell. Also looking at medications and whether or not those are making things worse, and medications that might be able to help manage your mast cell symptoms, as well as increasing this threshold of tolerance. So I love this histamine bucket theory. Feel free to look up more on that with mastcellaction.org. But it's the idea that it's not just one thing, but if you add in, elements in your diet, you add in stress, you add in smells, these all kind of tip that bucket over eventually. And that's when we see more of those mast cell symptoms. All right, so the perceived extent of joint hypermobility, again, this is our own perception of how hypermobile we are. So looking at options for wearing splints or orthotics, you see here, this was a study, you can see this woman's photo that her knee hyperextension is significantly improved with wearing these are called dynamic fabric orthoses, DFOs. And so, even compression leggings and those kinds of things, but there's a variety of options for this that can help your whole body to feel more supported and more in alignment. There's also quite a bit of research now, including a brand new study that came out this summer on foot orthotics. And so looking at, how getting custom orthotics in your shoes could really significantly affect your fatigue, amongst other things. Overall, looking at tools in general to manage your hypermobility and provide feedback to your joints. We know that proprioception, or where is your body in space, that overall if we improve that, then we see improvements in fatigue. And then, of course, considering ergonomics and workstation modifications, having support, not sitting like this woman is, where she is, hopefully she's taking breaks in her day and leaning back, but having that support throughout your day. And lastly, from this research is physical activity. And so, of course, we have all probably heard that movement is helpful in improving our fatigue levels, but sometimes that feels counterintuitive. So finding the best physical activity for you as an individual, the appropriate types of physical activity or movement practices. And I often like to encourage people to use these rate of perceived exertion scale, which helps you to know how much you're pushing yourself rather than measuring heart rate. It's ideal to work with a physiotherapist or a physical therapist or a specialist who at least is willing to learn and work with you, and considering progress, not perfection here. I did want to point out that myalgic encephalomyelitis, or chronic fatigue syndrome, is a different ballgame. And so if you have this diagnosis, or if you are working with someone, recognizing that physical exertion can be counterproductive for these folks. And so just understanding this, we need to really learn a lot more here, but that Graded exercise therapy is contraindicated. It is not indicated, but that doesn't mean that no movement or no exercise is helpful, but really do no harm, and finding what's specific for that person is helpful. And lastly, I wanted to add in just the consideration of your breathing pattern and how that really affects our energy levels when we're awake and when we're sleeping. So trying to work on some belly or abdominal breathing, some diaphragmatic breathing, just in and out through your nose, where your belly rises as you inhale and your belly falls as you exhale. Not pushing yourself to do a prescribed, really long breath, but just working on over time, extending that exhale and being consistent. And then lastly, cognitive fatigue, just a few points here about aspects that might help you to manage cognitive fatigue. Specifically, using supports, give your brain a break and allow there to be other things that you can count on, so that you don't have to hold all of that in your brain. Minimizing avoiding triggers in general, using support devices that help with that proprioception or that body awareness can actually decrease the demand on your own attention. And then using water therapy for POTS. So if you have POTS, chugging or rapidly drinking a glass or two of water has been shown to, in the short term, improve your ability to use those cognitive demands. Physical exercise, again, taking breaks, alternating the type of task, and then those sensory supports. And then this is just a resource if you're looking for accommodations for school or work. This is a really great website to check out. They have guides. I'd love to connect with you, so feel free to find me on Instagram. I post a lot about POTS and EDS. And yeah, I hope this was helpful for you. And thank you again to the Ehlers-Danlos Society for inviting me, and thank you for listening.